Perez. I'm the nurse that attended you last time with your health history. Do you remember?
Yes.
Alright. I'm actually going to be doing your physical examination today. Is that okay with you? Alright. I'm going to go ahead and have a seat right here just to ask you a couple of really quick questions. Just want to make sure that you do know that everything here is confidential. Whatever happens will stay here. Okay? Is there any religious or cultural identifications that I need to know so that I do not offend you or say something that perhaps you don't want me to discuss? No? Any part of your body you would not like for me to look at today?
My ears,
Your ears? Okay.
recent surgery.
Okay, recent surgery, so we'll avoid the ears. Now, only because we're doing a video as well, I'm going to go ahead and just explain it as if we were doing it, and then you can just follow along. Alrighty. Okay, Mrs. Munoz, so we're going to go ahead and start with taking your vital signs, because your vital signs actually can tell us a lot about your baseline and what's going on with you. Okay, so I'm going to go ahead and check for your pulse first. Okay, so what I'm going to do is use your radial with my 2 fingers. Okay, for a minute. For the purposes of the video, I'm only going to count it for 30 seconds and I'll try to text you. Okay, so 72 is your pulse. Alright. I also counted your respirations, 18 respirations, okay? And I'm also going to check your blood pressure manually. If I could have you please insert the cuff for me. And relax your arm for me. There we go. Actually 124 over 72, which is normal. The normal is usually 120 over 80, so you're within the baseline. Now I'm going to have you go ahead and we're going to take your height and your weight. Let me help you with your gown. Okay, very good. Alrighty, if you could just, give me 1 second. Let me set up the scale for you. Just stand on the floor. Good, so 151 pounds. Okay, get off your face a second. Very good. Now what I'm going to have you do is go ahead and turn face forward. There we go. Straight, all the way to the back. All the way to the wall. And you are actually 5'5" and a half. Okay. So if I could just have you have a seat real quick for me. Now your BMI is usually your body mass index. We calculate it by your height and your weight. Okay. Your height squared times your weight in pounds times 703 and divided. I'm sorry. So what we're going to do is actually calculate yours today, okay? So you weighed actually 151 pounds. So we're going to divide that by 65 squared, okay? Times 703, that gives us originally 25.2. So in the BMI scale, 25 to 29 is a little bit overweight, okay? But you're almost there. Appropriate weight is 24.9. So you're still there, okay? Any pain, Mrs. Good. I'm going to go ahead, since we walked in, I've already been checking that you're awake, you're conversing with me. But can you please tell me your full name? Okay. Can you tell me today's date? Okay. Can you tell me where we're at right now? Approximately what time is it? Okay. So you're awake, alert, oriented types person, place, setting, and date. Okay. Now, inspecting your head, making sure that there's no fasciculations, that there's no tremors, that there's no tics, okay? Making sure that it's midline to your body. When you stood, we noticed that it was midline, okay? I'm checking for any lesions, any scars, anything of abnormality. I don't see anything, okay? I'm now going to go ahead and wash my hands. I'm going to put on my gloves, okay? And I'm going to inspect your scalp. I'm checking for any scaliness, any irritation. Good. Now, what I'm going to also do is palpate, which is feel your skull, okay, from the front to the back. And what I'm doing is I'm just checking for any nodules, any masses, or any tenderness. Good. tenderness? Good. Okay, Mrs. Williams. That's good. We're going to go ahead and continue on. I'm going to check your hair. I already felt it. It's not brittle, it's strong, it's colored brown. It's pretty much fairly equivalent on both sides. Your hairline is right about here. I don't see any receding issues. A little bit of thinning of the hair, but I'm sure that's how your hair texture is. Okay, I'm checking your face as well. Checking out the eyes. The eyebrows are the same level. Your eyes are the same level. Your nose is symmetrical. Your mouth, your lips, clean, dry, intact. I don't see any sores. Okay, if I could just have you smile for me. Good. So what I'm doing is I'm checking the nasolabial. Okay, folds. Those are good. And also the folds around your eyes are equal. Okay. I'm going to go ahead and ask you to just open and close your mouth for me. I'm checking your jaw. Good. I'm palpating the temporal mandibular joint for crevices or any swelling or abnormality. Okay, good. Now we're going to go ahead. If you were in a regular hospital setting, we would have a Snellen chart ready for you to visualize your optic nerve, okay, the function of it. And what we would do is we'd ask you to cover one eye, and you would read off randomly the lines that we choose until you get to the smallest line that you can read, and then we would do the same thing for the opposite eye. Normal vision is 20/20. It's a fraction. The first number is the distance from the wall that you are, and the bottom number is what people usually read at that distance. Okay, so 20/20 is normal. 20/200 would be legally blind. Okay, all right. Now we're going to go ahead and check the visual fields, Mrs. Munoz. What I'm going to go ahead and ask you to do is with the gauze, if you could just cover opposite eye. I'm going to stand about 3 feet around from you. You're going to cover your right eye, and I'm going to cover my left eye. Okay, you need to look straight at me. When you go ahead and see my fingers, let me know. Okay, I'm timing for the same time. Good. Switch, please. Good. So if we would have had a delay, then I would be worried, but since it was the same, we're good. Okay. Now I'm going to also check for your eyelids, your eyebrows. Can you please close and open your eyelids? Good. No difficulty with that. I see equal amounts of eyelashes. I don't see any lesions around your eye or any lipid depositions. You can just close your eyes. I'm just going to help you a little bit. There's no tenderness and all that. I'm able to move the eye. Good. Okay. Now I'm going to look at the sclera. It's white. Okay. Both sides are white. I'm going to shine a little bit of light. Just checking for vascular changes. Good. There's no yellow color. No indication of jaundice. Okay. I'm also checking the pupil. It's reactive. It reacted to about a 2. That's your size. The irises are the same color, brown. Okay. Brown, equal. I'm also going to check the conjunctiva, just making sure that it's not hemorrhaging. No severe vasculature color. Usually it's like a light pink, not a deep red. And it's actually light pink for you as well. No ptosis, meaning that the eyelids are not drooping over either. Okay. Alrighty, Ms. Munoz. Now we're going to go ahead and check for your actual reaction to corneal sensitivity. So what I'm going to do is I'm just going to have you stare straight at the wall, and then I'm going to just touch a little bit. Use a cotton ball. That should be better. Ready? Good. Good. So that was actually checking for the trigeminal nerve, cranial nerve number 5, and your facial nerve number 7, which means that they're both intact. Okay. Now I'm also going to check your eyes. I'm going to go ahead and dim the lights for a little bit. Okay. What I need you to do, Mrs. Munoz, is just look straight at me. What I'm going to do is shine a light directly into your eyes, and I'm going to make sure that the light is equal on both pupils, okay? Good. Now, I'm also going to hold for accommodation. So what I need you to do is just look straight over there at the wall, okay? And then when I tell you, you're going to look at my finger, okay? Or at the light. Ready? Good. So there is constriction of the eye. I'm going to turn on the lights again. Okay. So what we did was we checked for your pupils being reactive. You were reactive to the light. The first 2 times that we did it, they're round, they're equal, and they accommodate, meaning that they go from distant to close. Okay. Good. That is it. 3 of your cranial nerves. They're ocular motor, your trochlear, and your adducens. Now we're also going to check for range of motion, which will reinforce those cranial nerves. Okay. You could just follow my finger, please. Very good. Very good, Mrs. Munoz. Now we're going to do the corneal light reflex. We're going to go ahead and put the source of the light at the nasal of the bridge. And what I'm going to do is I'm going to check for reflection to be equal on both sides, symmetrically. Good. Now, if we had an ophthalmoscope, this is where we would go ahead and assess the fungi, the disc, optimal disc. What we would do is we would use the same eye. It would be a light otoscope with a very bright light. With that light, I would be able to go and see into the retina. Behind the retina, there's the optic disc. What we're checking for is any occlusion or opacities or hemorrhage. Okay, since I don't have the device, I'm just explaining it to you. All right, so you said you did not want me to look at your ears, correct? So we're going to go as if your ears were out, okay? We want to check for alignment. Alignment is usually measured with the inner canthus with an imaginary line, okay? So they will be right about here, so I can pay what you want. The articles, which is the top part of the ear, we should check for any changes in skin coloring. Hopefully there wouldn't be any lesions, cauliflowering of the ear, or any abnormalities in the cartilage, okay? And then we would pull it down just to check for any pain, no pain noted. And we would be able to record, okay? The other thing that we would check is we would also make sure that we had a otoscope to check the ear, the inner ear, okay? So what we would do is for an adult, we would go pull up and back, okay? With a otoscope, we would go in about 1 to 1.5 centimeters. We would look at the ear canal, make sure that it's not red, it's not hemorrhaging, there's not no cerumen occluding it. And I should be able at the very end of the canal to be noticing the tympanic membrane, the eardrum. Excuse me, the eardrum should be a pure pearly red color, okay, with no bulging, no perforation, and it shouldn't cause you anything for you to see. Okay. Alright. So we already checked your articles. Now we're going to inspect the canals, like I said. Now we're actually going to do the auditory acuity, and this is cranial nerve number 8, which is the vestibular cochlear. What I'm going to do is I'm going to ask you to repeat what I say, but it's going to be whispered, okay? So you could just repeat.
I took my dog to the park today.
Good. And the same thing on this side.
I took my cat to the park today.
Very good, Mrs. Munoz. So we're just checking for the actual function of the sense. Now we had 24. We would check for the Weber test and the Rhine test. The Weber test, we would make it vibrate, put it in the midline, okay? And then I would ask you to let me know if both ears are carrying the same amount of vibration, okay? Now, to check for the Rhine test, what we do first is we, with the vibrating tuning fork, put it on the vestibular bone, and then you would let me know when you stop hearing the sound, okay? And then for the second part, for air conduction, we put it right next to the ear canal. Usually air conduction is twice as longer than bone conduction, and that's what we want to make sure that that's normal, okay? So the equation is 2 to 1. Now, we already inspected the outer part of your nose. We wanted to make sure that there was no abnormality, okay? I'm going to palpate just with my fingers, making sure that there's no masses, that there's no tenderness, that the bridge is normal, everything is in a straight line, it's not deviated, okay? Now with the light pen, I'm going to go ahead and, before we actually use the light pen to look at your nerves, I'm actually going to palpate the sinuses since I'm already here, okay? So we're feeling the frontal, any pressure there, and the maxillary, any pressure there. Good. Okay, this is when you're saying you should make sure that it's not occluded. So what can you do for me is just occlude one nerve and do that for you. Same thing on the other. Good. Now I'm actually going to check the inside now with my light pen and my spectacles, okay? So what I'm checking for is for any nose, any polyps, any distension. Everything seems to be good. The mucosa is pink with clear drainage, which is coming from the brains, okay? Alright, now we would be worried. I also was able to see that the septum, the nasal septum is not deviated. It's not deviated. It's straight. That's good. Okay. Alright. Now I'm going to go ahead and ask you, we're going to go ahead and test your cranial nerve number 1, which is olfactory, okay? So you're going to close your eyes. You're going to include one mirror, this one first. And you're going to tell me what you smell.
Cigarette.
You could do it for the same thing on the other side. And what do you smell? Okay. Good. So cranial nerve number 1 is in speed. Okay. Now we already checked your lips. We checked everything. Now I need you to smile for me. Good. I need you to poof out your lips. Good. Purse out your lips like you're gonna whistle. Good. Close your eyes shut for me. Good. Just a regular smile. Very good. Raise your eyebrows for me. Good. We're checking cranial nerve number 7, facial movement. Okay. Go ahead and do this for me again. I'm checking your teeth. There's no overbite. I'm checking the lip and the close it. Good. Now, with my light pen, I'm also going to check your actual tongue. I'm going to check for the protrusion of it. Okay. So what I need you to do is just stick out your tongue for me. Good. Move it side to side. Good. Touch the top of your tongue, of your mouth. Sorry. Good. I'm checking at the bottom, making sure that there's no vascularity changes. Good. And now downward, like you're touching your chin. Very good. So that means that your tongue is actually moving. That's also cranial nerve 12, which is hypoglossal. I'm sorry, cranial nerve number 11, which is glossopharyngeal, and cranial nerve number 10, which is the vagus, which we're also going to assess. And just get some gloves real quick, okay? Okay, this is something else. Now we're going to go ahead and check your actual lateral sides of the tongue, and then the inside of your mouth, and then we close up, okay? Gloss. Okay, so go ahead and open your mouth for me, please. Alrighty, good. So I'm checking the tongue. Good. We're checking for the gap reflex, which is good. I'm checking the steps and ducts, which are not really inflamed, but saliva is noted. Okay. Now I'm going to ask you to please also notice your oropharynx, okay? Your tonsils are grade 1, which means that they're in the tonsil cavity. They're not swollen, they're not engorged, they're not touching, okay? And you notice any swelling or abnormalities there. Your gums are red, a little pink, which is good, coral red pink. No noted bleeding or any hemorrhaging of any form. Your teeth are all in place. You should have 32 teeth, okay? Now I'm going to go ahead and ask to check the size of your tongue. What I'm going to do is ask you to stick out your tongue for me, and I'm going to pull it out with a gauze, okay? Have two gauze for me now. Good, I'm just checking the lateral sides. Good. And that was actually cranial nerve number 12, the hypoglossal, that allows you to stick out your tongue for me, okay? Alright, I'm going to do all the movements of the tongue, and I'm just going to palpate one more time the tongue just to make sure. So no noted lesions, no roughness, nothing of that. Okay. Alright, this is my nose. I'm going to go ahead and check your throat. I'm going to ask you to take a sip of water for me. I already saw that it's midline, there's no deviation. I'm going to palpate real quick just to make sure that I feel good. So the curvature, the process, the isthmus, and this is right about where the thyroid line should be. Okay, so what I'm going to do is I'm going to check this side first. I'm moving it out of the way. Now take a sip of water for me. Good. Same thing for the other side, okay? So we're moving it out of the way. Swallow. Very good. So I don't hear any nodules or any enlargement, okay? Now we're going to auscultate with the bell. What I'm doing is I'm checking for any fluid. If it's swollen, then we should hear like a kind of sound. Hopefully we won't. Okay? So there's no noted bruit. I'm also going to check, since we already heard your carotid artery. There should not be a bruit noted, but still, I'm just going to copy and make sure I'm in the right place. Right. Now your cervical lymph nodes, which is your neck, your trapezius, and your axillary muscles, okay? Good. No tenderness, no swelling. Okay, so that's good. Okay, Mrs. Munoz, now we're going to go ahead and ask you to please stand. I'm going to check your back. I'm going to palpate it for you. We're going to have you turn around just like that, right there. Okay, we're checking. No deviation. What I'm going to have you do is, if you can do just a full extension, touch your toes for me, okay? Go ahead. And I'll make sure to hold your gum. Touch your toes for me. Good. So we're checking the cervical, the thoracic, the lumbar, and the sacral processes. No deviation noted. I'm also checking for rib humps, making sure that there's no scoliosis or S curvature of the spine. Very good, Mrs. Munoz. Okay. Let me go ahead and close this for you. There you go. Alrighty, Miss Munoz. Now if I can have you just let me close this real quick. There you go. If I could just have you go ahead and walk over to our bed, and I will be right there with you. And just sit down for me because I'm going to check what we call the CBA tenderness, okay? I don't know if it's possible for you to turn your back to the camera so they can see. There you go. So what we're checking for is for any noted swelling or tenderness of the actual kidney, okay? So it's right about this angle. I'm going to just percuss. Any pain?
Nope.
Okay, so we already felt for the diaphragmatic excursion, Mrs. Munoz. What I'm doing now is I'm going to palpate for diaphragmatic positioning, okay? So we're going to start from the bottom up, and we're going to just hear resonance, okay? There's a difference there. And I'm just going to keep going up, okay? If you could just, the first time was expiration, so if you could just inspire and hold it for me. There you go. Okay. So then this should be about 5 to 6 centimeters, Mrs. Munoz. And it's exactly at about 6 centimeters. So that is good. Okay. Already palpated the tenderness with the CBA. What I'm going to go ahead and do is actually just assess your chest, okay? So I'm checking for symmetry while you're breathing. You already noted that your respirations were normal, okay? I don't see any difficulty. It's not labor. Now what I'm going to do is I'm going to actually place my fingers on your back, about the 10th or 11th intercostal space, and I'm going to ask you to just take a deep breath, please. And exhale. One more time. Good. So what I was checking for was symmetry of my fingers moving up and down, okay? One would have been higher than the other, then we would worry. Okay, I'm also going to actually palpate the chest. Just make sure that there's no abnormalities. I'm actually going to go under, but that's okay. Just down. Good. Now, what I'm going to have you do is, I'm going to put my palms on you. What I'm checking for is dermatitis. I'm going to ask you to just talk to me and tell me what your favorite color is.
Blue.
How many children do you have?
One.
What's your favorite food to eat?
Enchiladas.
Good. So vibrations are felt, and that's normal. If I didn't feel vibrations, then I would be worried of error or maybe something else being entrapped, okay? Alrighty. Now we're going to actually palpate it, and we're going to percuss now. Okay, so what I'm going to ask you to do is you're going to bend your neck down, and you're going to hug yourself. Hug your arms. There you go. And I'm going to palpate the back, okay? Starting from the top all the way to the bottom. And what I'm doing is just checking for abnormalities. Good. Okay, same thing in the front. And I'm just going to have you. Okay. Now we're going to go ahead and have you raise your arms. Sorry. Now I'm going to go ahead and check for dullness in the lateral sides, the anterior sides. Okay. You're going to go to the side. Okay. Same on the lateral side. Okay, and I'm going to go under since it's kind of explosive. And good. Alrighty. I'm going to auscultate real quick your breath sounds. I'm going to start with the back and then go to the sides, back and forth, and the front, okay? Okay, please have me take a deep breath in. Good. Deep breath in. Good. Deep breath in. Good. check the sides, okay? So technically I would have to go under, so I'm going to go through the side, okay, to not expose you. Deep breath. Good. Deep breath. Good. So those little abnormalities, no augmentation sounds, okay? No wheezing or anything like that. I'm going to go through the front this time. Same thing. Steady breath. Now we're going on to the heart, okay? The apex of the heart is usually the fifth intercostal clavicular line, so right about where the rest area is. What I'm going to do is I'm going to ask you to hold your breath. I'm going to listen for heart sounds, okay? And I'm actually going to have to go in again through the bottom. I'm sorry. Good. I hear good S1 and S2 sounds, which means that there's a contraction and relaxation of the heart. I don't hear any murmurs or S3 or S4, which are extra beats to the heart, okay? Now, to save some time, I'm just going to explain to you where I would assess next. Under the skin, we assess 5 different parts. The aortic, which is going to be the right second intercostal space, which is right about here. Then we're going to do pulmonic, which is the second left, right across. Then second pulmonic, which is around the third area, right about here. Then the fourth level tricuspid area, right about here. And then the fifth is the mitral, which is where I was. Okay, and those are the 5 places that we have to listen for. Now I'm also assessing your neck. I'm checking for any distension of the jugular vein. Okay, I don't see any. Now if I did see some, we would have to do further settings, or we would sit you up little by little to see at what angle it disappears or what angle it begins. Alrighty, Ms. Munoz, what I'm going to have you do is just lay down for me on this side, please. And we're going to actually start looking at your stomach, okay? So I'm going to cover your feet just to make sure that we don't expose anything. Good. Good. Okay, so what I'm looking at first is skin color and texture. Okay, I'm checking for any abnormalities, any changes in skin. I have noted a little bit of what we call knee rise, but I don't see any. So I'm just checking. It's flat, not distended. It's round. That's normal. Okay. I'm also going to go ahead and inspect for any masses, any lesions. I don't see anything. Now I'm going to auscultate. I'm going to listen. Okay. What I want to listen for are bowel sounds in 4 quadrants. You divide it in like that. 1, 2, 3, 4. You should hear about 35 in a minute. So I don't hear anything abnormal. It's good bowel sounds. So what I'm going to do is lightly palpate with the palm of my hands. Okay. No distension, no tenderness. I'm going to deeply palpate, just checking for any swelling, any masses. No. Okay. Then we're going to go to the right side. Right about here is where the aorta distends. And what I'm going to ask you to do is just relax and try to feel any pulsations. I don't feel any. If I did feel some, then that would be an indication of aortic aneurysm. Okay. Now we're going to try and palpate the liver. So I'm going to go over to the right side with my left hand under. The liver's right about here. I'm going to start palpating, okay? I shouldn't be able to feel anything. I'm going to move across to the right side and feel the same thing for the spleen. If the spleen is palpated, that means that there possibly is enlargement due to infection. I don't feel anything. Okay. Now as far as the kidneys go, it's a little hard to palpate them. So for the left one, we're going to go ahead and stand right here, and I'm going to lift it just a little for you, and I'm going to palpate right about here. And there's no palpable kidney. I'm going to go over to the left side. Same thing. And palpate. And actually, I feel that one just a little right about there. Do you feel where I'm feeling? Good. Okay. Alright. Now we're going to percuss Mrs. Munoz. Meaning I'm going to put a little bit of tapping. And what I'm going to do is I'm going to try to feel for the borders of the liver, okay? So what I'm going to do is I'm going to start from the stomach up, okay? So here we go. You hear the difference there? Okay, so we would put a tape here indicating where the border of it is. Then we're going to continue going up until we hear it, okay? The difference is right there, can you tell? So we put the second tape there, okay? Alright. Now for the spleen, that one's a little harder since it's so small usually. But we still go to the side and we palpate mid-axillary line. Pretty much just all regions, making sure we don't hear any difference. There we go, okay? Alright, good. Alrighty, Miss Munoz, now we're going to go ahead and check your lower extremity. So what I'm going to ask you to do is just please cover yourself, and we're going to have you just uncover your legs. There we go. Okay, so I'm checking for skin. I've already checked the back of your skin. I did note a couple of nevi, which are like little, what we call in Mexican terms, lunares. That's normal. Most humans have about 8 to 10. That's approximately what you have. I don't see any changes in border or any indentations. They're soft and flat. And I'm checking the legs. I'm checking that there's no changes in color, no differences, and I'm actually going to palpate for pulses now. Okay. So what I'm going to ask you to do is just relax, and we're going to go ahead and check for pulses. These are the poplets here. Okay, with an amplitude of 2. I can feel them very well. Second one here. Good. Now we're going to do the dorsalis pedis, which is right about here. Checking with an amplitude of 2. Notable. Same thing on the other side. Very good. That's 2 notable. Then we're going to just kind of go to the ridge right here. If you could turn your foot a little for me. There we go. And this right here is the tibial pulse. And it's right there, plus 2. And same thing on the other urothelium pulse. Plus 2. Okay. Alright, Mrs. Munoz. Now we're going to go ahead and check for your nails. Okay, so I'm going to look. I know you have some artificial nails. That's fine. What I'm checking for is clubbing, making sure that the nails don't club over. Checking for capillary refill. That's good. No noted pigmentation inside of the nail cavity. No splitting of the nail. Okay. Now I'm also going to look down to your feet. I'm checking the cavities here too for the nails. Everything, every finger, every toe has a nail, okay? I don't feel any difference. Obviously it's colored, so I can't really see capillary refill, but your toe is still warm. Okay. Alrighty. Now we're gonna go ahead and check your actual musculoskeletal system. So you're gonna go ahead and sit up for me, Mrs. Munoz. Very good. Okay, while I was assessing, I was also looking at your joints, okay? We checked the ankle. Okay, we check your wrist. Nothing there. Okay, fingers are good. I don't feel any discoloration or any heat or warmth or any redness. Okay. We checked your neck and your shoulders earlier. Okay. Alright, so what I'm going to have you do is just, we're going to go ahead and tighten this up. So you're going to turn around for us. And just sit right about there. Okay, so we're going to do this with your head. I want you to go ahead and look up towards the ceiling. Good. And you're going to touch your chin. Very good. Now, you're going to touch ear to chin. Shoulder, sorry. Ear to shoulder. Good. Now, chin to shoulder. Chin to shoulder. Good. Now, I'm actually going to apply resistance. Okay, so try to touch your, no, the other way, with the chin. I'm sorry. There we go. And so I'm checking for range of motion as well as muscle tone and both. Okay. Now we're actually going to check your shoulders. I want you to shrug your shoulders for me. Good. You're going to raise your hands up and above. That's flexion. Good. Then you're going to stretch your arms behind you like you're trying to push the back of the seat. Very good. Then you're going to go ahead and one hand's going to go on your back like this. There. And then one on the waist. Good. So that's internal and external rotation. Same thing on the other side. Internal and external. Very good. Now we're going to go ahead and have you swing your arm in front of your body. Like straight. There we go. That's abduction and then swing out. Adduction. Same thing for the other one. Abduction. There you go. And swing out. Good. Now I'm going to have you grasp my fingers, so I'm checking for strength. Good. That's about a 5 out of the strength. Okay, so was your neck? I didn't read it. I'm sorry. Now for your elbows, I'm going to go ahead and have you bend them and extend them. Full range of motion. Good. Now you're going to try to bring them up with my... Good. Very good. That's a +5. Now you're going to try to bring them down. The other way. Bring them down. Very good. +5 as well. Okay. Okay, now we're going to check your wrists and your fingers. Mrs. Munoz, I need you to go ahead and bend your fingers down. Now upward. Good. Now I need you to touch each finger to your thumb. Very good. Now you're going to close and open. Good. Now you're going to put your wrist here. Close up. What I want you to do is just move your wrist. Very good. Very good. So we're checking for rotation. Alrighty, Mrs. Munoz, now we're going to go ahead. I already touched your toes, and I made sure that everything was fine there. Okay, but can you just open and close them for me? Good. Can you dorsiflex and touch down? There you go. And one last thing I need you to do is go out and in. Out and in. Very good. Alright, we checked your spine as well earlier when we did the scoliosis and the lumbar, so everything there was full range of motion. We were able to extend. Now we're going to check your knees, and then we'll go to your hips, so I don't have to push you up and down. Your knees, pretty much all I need you to do, Mrs. Munoz, is if you could just bend it up for me. Good, and bend it down. Same thing. Bend it up and bend it down. Good. Now you're going to try and bend it up against my force. Good. And good. So full range of motion, extend it out. Okay. Now you're going to go ahead and lay down for me, Mrs. Munoz. I'm just going to go ahead and check your hips real quick, okay? Okay. I'm going to actually have to cover you because since you're lying down. But what I want you to do is raise one foot as high as you can. So you're going to extend it out. Okay, just one. Extend it out like this. Flat. There you go. And same thing on the other way. Good. Now you're going to bend it up, which we know you can do. Good. And same thing on the other. Good. Now, doing it like that, you're going to go ahead and do an internal rotation, which means this knee is going to try to touch this knee. Very good. Rest it. Same thing on the other one. Rest it. Very good, Mrs. Munoz. Okay. All right. As for your nervous system, Mrs. Munoz, I'm going to have you lay down like that. I already know that your mental status is good. You're awake. You're oriented. You've been answering and follow directions. That's great. You don't look sad or depressed. You have a good effect. You've been communicating well. I'm going to go ahead and check your responses for sensation, okay? What I'm going to have you do is just relax, close your eyes, and then you're going to tell me what you feel, if it's sharp, dull, or soft, okay? So you can just tell me what you feel. Sharp. What do you feel? Soft. Okay. What do you feel?
Sharp.
What do you feel?
Soft.
Good. Okay, so that's sensory. Sensory means that you're able to sense what you're feeling on your skin. We already did your cranial nerves, most of them, the ones that we had to do, we were identified as we did. Okay. Alright, now we're going to just go ahead and finish with a couple of little exercises to make sure that your reactive system is okay. So I'm going to have you sit up for me. Good. And then you're going to face this way. Face it. There we go. Okay, this is what we're going to do. It's called the, like a child game. You used to clap hands. What you're going to do is you're going to put your hands on your thighs. And then you're going to go ahead and just go, you're going to tap your knees and then up, down, okay? Just continue doing that until I say stop. Good. So there's no noted stiffness, no jerkiness or chronic movements, okay? Now we're going to go ahead and do a point-to-point movement. What I'm going to have you do is you're going to extend your arms like this for me. You're going to touch your nose with the tip of your finger. Same thing with the other side. Tip of your finger. And just keep going. In and out, in and out. And then I'm going to tell you to touch my finger at any random point, and you need to touch it, okay? Touch finger. Good. Keep going. Touch my finger. Very good, Mrs. Munoz. All right. Lastly, we're going to just do reflexes, okay? To save time, I'm only going to do it on one side, but if this were normal, we would do it on both sides and compare, okay? So we're going to use my reflex hammer. We're going to do this side since I'm already on this side. We're going to do the bicep first. You're going to put your arm at about 45 degrees. the elbow, flexion of the elbow is normal. Now we're going to do the triceps. You're going to go ahead and bend your elbow this way for me, like 90 degrees. Like this. There we go. It's okay. I'm going to feel your elbow. I'm going to palpate the AC fossa, strike it directly above the elbow. Ready? This should give us extension. Good. One more. Good. Okay. Now we're going to go ahead and do the brachial radialis, which is right about here. I'm going to rest your forearm in my forearm, and your hand should be able to feel it, okay? You let me know if you do. Good. Very good. Okay. Now we're going to check the patellar. If I could just have you scoot back a little more to keep your knees off. There we go. Ready, Miss Miss? Good. Very good. Okay. Then we're going to go ahead and do the Achilles tendon, which is the back of this. And I'm going to hold your foot for you. Okay. Good. And then lastly, we're going to do the plantar or Babinski, okay? What you're going to feel is this sharp sensation. You should be able to see your big toe move, okay? Good. Did you feel that one? One more time. Very good. Okay, Mrs. Munoz, so what I'm going to do is go ahead and document all my findings. Honestly, everything looks good. We'll go ahead and communicate everything